Hello, I'm Dr. Julie Anne Maney. I am a consultant in paediatric emergency medicine, and I would like to talk to you today about the communication domain. So in my role as a consultant in the emergency department in children's, I work a lot with children and young people, so it's important to communicate on different levels with different age groups. It's important to get down to toddlers and talk to them at their own level, and we all use different language when we're talking to adolescents and young people, and a good communication tool for that is the HEADS assessment. We also communicate within a team, and we speak to professionals on a daily basis, and it's important that you communicate with those professionals in terms of what you want from them, in terms of what you have to give them, in terms of their patients. So the information needs to be precise and succinct when you're handing someone over to somebody, and you need all the pertinent details. So communication is part of a paediatrician's job day and daily. Where communication domain is particularly important to get experience of when you're a trainee is having difficult conversations with parents and children, breaking bad news, and unfortunately one of the jobs that we have to do in the emergency department is tell people and families when their child has died. Now that's particularly difficult, but something that you have to learn and you have to have experience of, unfortunately, because children will die inevitably, and emergency departments are where they will be brought. It's very important that we do that with empathy and kindness and compassion, but also that you deliver the information in such a way that it's understandable and that people can understand what you're telling them in that most awful of times. I also work as a safeguarding lead in the emergency department, and often that is when communication becomes most important. And as a trainee, it's often difficult to have those difficult conversations when you are highlighting issues that are of a safeguarding nature. For example, unexplained bruising, or delay in presentation of burns or fractures, or children who present who are obviously neglected or have emotional abuse in their background. And that's often very difficult, but a really important part of communication. And hopefully our trainees, we can equip them with the tools and stock phrases and information that can be useful when delivering that information in a safeguarding context. So for example, we would say, well, we have roles and responsibilities, and part of my role now is to follow a safeguarding pro forma, and we offer to explain that to parents. We explain how we're going to refer them, what's going to happen next, in simple terms so that people understand exactly what's happening. I also work as a forensic medical examiner for the police service, and in that role communication is absolutely key, and often the communication is slightly different from my role here in the emergency department. It's a little bit more direct, and the questions are more directive, and it's important for evidential purposes, for gathering evidence for court, and also to work in partnership with families. Communication is the key and the core of all paediatric training, and it is extremely important. Also, whenever we communicate within different teams. We communicate in writing, and particularly for safeguarding, we would communicate with social services, with the court system, with the police, and often we're asked to write reports, and that's another important part of communication, and often something that trainees don't get exposed to, but it's really important. And we often have a test case or a made up case or a simulated case where we would say, now could you maybe do a court report for that, and we'll go through it with the trainee, we'll go through it with ourselves, and make sure that you're giving all the information, that what you're giving is fact. If you're asked for an opinion as an expert, that's fine, but for trainees and for communication purposes at this stage, we would generally be giving facts rather than opinion. And how you lay out a report, it's also important to know who the report is for, whether it's in a court arena or if it's for social services, because the report will be written slightly differently. So communication, just to clarify and to recap, is the core of all paediatric training. The better you can communicate, the better paediatrician you will be.